Hello, everyone. Good day, everyone. How are we all doing? This is another episode of correcting misconception and misbelief in health. And on today's episode, I will be talking about different diseases, but I'll be concentrating mainly on heart, on what we call cardiovascular, on what we call cardiovascular diseases, like what we actually call cardiovascular disease. That is what I'll be concentrating on today. And when we talk about cardiovascular diseases, what do we actually mean by cardiovascular diseases? Cardiovascular diseases, these are diseases that affect the heart and the blood vessels. Those are the blood vessels around the heart, blood vessels supply to the heart or taking away blood from the heart. The heart and the blood vessels. The diseases that affect the heart and the blood vessels are called cardiovascular diseases. Now, I'm going to divide this topic into types, causes, signs and symptoms, and preventions. Now, the first type of cardiovascular disease we are going to talk about today is coronary artery disease. We call it coronary artery disease, CAD. And what is coronary artery disease? It is also known as ischemic heart disease, and it occurs when the coronary artery supplying the heart with oxygenated blood, with oxygen filled blood, is filled, though that artery is filled with an opaque build up. There's a build up of an opaque, like fat is built up around that blood vessel. That artery supplying the heart has fat build up on it. Let me give an illustration. Let's assume that this is the artery. This pipe, this whole pipe here is the artery supplying the heart. Then fat tissue start blocking it. Fat deposits start blocking it. It will now reduce the space. If the blood used to pass through the space like this, it will reduce the space like this because fat will fill up the remaining space, will fill up some part of that vessel. In that case, it is called coronary artery disease. Now, in this coronary artery disease, it can lead to angina. Angina is simply chest pain or heart attack. It can lead to angina, which is chest pain, and it can also lead to heart attack. Yes. Now, what are the symptoms? Like, what are the signs and symptoms you will see, and you will say this person is having coronary heart disease? Number one signs and symptom is, as I said, chest pain, angina. Next one is shortness of breath, not being able to catch your breath. You're easily having shortness of breath, you're not really breathing properly. Another one, as I earlier said, heart attack. When that heart attack occurs, it's characterized by that chest pain, sweating, nausea, and lightheadedness. That particular heart attack, it is characterized by chest pain, nausea, sweating. You are sweating more than normal, and lightheadedness. In this case, you know that this person is having coronary heart disease, CAD. Coronary artery disease, sorry. Now, the next one I want to talk about is hypertension. Indeed, I'm going to take this video step by step. I'm going to take it like different episode to talk about this. I can't finish talk about it in one video. Now, the next one I'm going to talk about is hypertension. This one is common. Hypertension, that is high blood pressure. Now, what is high blood pressure? High blood pressure is a condition where blood pressure in the artery is persistently high Yes. Now, in a case where there's coronary heart, the problem, the blood vessels around the heart has been filled up with that fat. The next thing that will happen is that the blood now pumping to the heart will be pumping under high pressure. It will no longer be passing the way it used to pass. It will be pumping under high pressure. And when it is pumping under high pressure, and that high pressure is persistently high, it's not like it pump under high pressure for some time and calm down. It is persistently high. That is what we call hypertension, high blood pressure. And it can lead to complications like heart attack, stroke, or kidney damage. 80% of stroke are caused by this hypertension. So be very careful if you're hypertensive. Take care of yourself because you want to avoid stroke. Now, what are the signs and symptoms? And it is often called a silent killer. This hypertension. Hypertension is a silent killer. It doesn't give you sign before killing you. So people can have high blood pressure and not know. Yes, you can have high blood pressure and you don't know. It is a silent killer. And what are the signs and symptoms of high blood pressure? Because it has no symptoms until significant damage has occurred. Some people may experience headache, constant headache, like unbearable constant headache, shortness of breath, and nose bleeding. Yeah, these are the signs and symptoms of hypertension. Now, for this episode, I'm going to end it here so that we digest these two cardiovascular diseases. The first one I spoke about was coronary artery disease, CAD. The next one I spoke about, the second one I spoke about is hypertension, commonly called high blood pressure. I think now you can know when someone has coronary artery disease, and when someone has hypertension. Thank you. Till we come again. The next episode, I'm going to talk about other types of coronary heart disease. Thank you.